This is Tom Biernacki, and today I'm talking about Tailor's bunions right here. If you have pain on the outside of your fifth toe, it's like a bunion of the big toe, but the fifth toe. This can cause a lot of pains rubbing in your shoes. We're going to show you all the best tips and tricks and a big secret to get rid of this for sure, and we're starting now. There are many types of Tailor's bunions. Number one, you could start with something called a bursa, which is not actually a problem with the bone, but it's a fluid sac. This is due to irritation, swollen joint fluid occurs. Number two, you could have a bump. You can see in the second example that fifth metatarsal head has a sharp, large bump. You could be born with this. This could be due to a prior broken toe. Third type is an angle in the middle of the fifth metatarsal. You can see it's not the angle between the fourth and the fifth metatarsal, but a deviation in the middle of the bone. Again, you could be born this way or it could be a break. And the last example is the actual angle in between could be fairly large, and this could be due to the angle between the fourth and fifth metatarsal. There is a lot that can happen to the fifth toe joint right here. You can have a bursa, which is a swollen chunk of tissue on the outside of the foot. You could have swollen, rubbed skin. You could have corns. You could have calluses. You could have a lot of problems here. You could have an ingrown toenail. The toe can flip and flop over the toe, but most likely this is called a Tailor's bunion, also known as a bunionette. This is a bump that forms on the outer side of your foot. It is similar to a regular bunion. And what a regular bunion is, it's essentially when the joint buckles in like this. If the joint itself has arthritis, so for example, if you can't bend the joint, that's more of arthritis or hallux rigidus. I have guides on all of those below. So arthritis, ball of the foot pain, we're not talking about all that. We've got guides on that. We're talking about the bunionette, which is pressure along the fifth toe knuckle. Putting this foot inside a shoe can be very painful. It can be very tender. We're gonna go over treatment options, the causes, the symptoms, and all the best tips and tricks to get rid of this pain. And at the end, I'm gonna be going over the biggest trick and the biggest secret that I see why people can't get relief from their bunionette pain, even with surgery. Here's the causes and the risk factors of bunionette formation. Genetics, a family history is more likely to cause it. Foot structure, so people with wide forefoots or long outwardly bent fifth metatarsals are more likely to get this. You can actually measure the angle of that bone on the x-ray, and in some cases, if it's really deviated out, that might require surgery. If you come see me as a podiatrist, we would get an x-ray. We would measure the angle of that bone. So for example, on x-ray, if there's a bursa, we could inject that. We could cool it down with topical creams or medications. If there's a bump from a prior fracture, a spur, you could shave it down. You could inject it. If there's an angle, you could modify it, you could offload it, you could correct it surgically. Or if there's an intermetatarsal angle, again, you could address that through flexible means that we'll talk about or surgical means that we'll also talk about. So if that bone is curving out, that may need surgery, may need procedures. If you have a swollen bursa, we could do an ultrasound, we could take an x-ray of that. I also love something called shockwave therapy. So shockwave therapy is a great device to massage that bursa down if you have tendinitis, ligament pain, swelling. We also have options like laser therapy. Other people get it because of footwear. So especially women are more likely to get it. Tight, narrow, ill-fitting shoes. Most of the patients that I see, their shoes are probably a little bit too small and they have hard stitched edges rather than soft mesh. Having mesh in the front of your shoe can make all the difference. It just prevents your toe from rubbing just as much, but a hard leather dress shoe can really cause some pain. Foot stress. So are you a runner? Are you a ballet dancer? These can aggravate that fifth toe. The symptoms include a bony bump on the outside of the foot, pain and tenderness at the side of the bump, swelling. It can feel like a fluid sac is built up there. That can be called a bursa. You could have a corn, a callus. You could have pain underneath it. Difficulty wearing certain types of shoes. So there are a lot of treatment options for a bunionette deformity. Most people think it's surgery, but it doesn't always have to be surgery. The most common thing that I see is getting the proper pair of shoes. Footwear modifications. Wearing shoes with a roomy toe box can immediately take pressure off that bunionette. Getting the right shoes, I go over my favorite shoes for bunionette deformities. I list those below, but basically you want something nice, soft, supportive. I love shoes that are running shoes, For example, ortho feet shoes if you're an older person. For people that are older, have a lot of biomechanical deformities, check out my favorite shoe guides down below. I'll go over that with you. Another great option for bunionette deformities are padding. Another thing is toe separators, toe pads, toe splints. Cushioning the bunion and the bunionette deformity with gel pads can be all you need. So for example, if you're a lady who has to go to business meetings, or you have a wedding or a nice dinner with your friends and you got to catch up and you need to wear those nice new shoes, that's when a gel pad or a splint can make all the difference. Simply putting that on, you don't have to switch your shoes. Just put that gel pad on while you're wearing them. That can make a lot of difference getting pressure off that knuckle, off that corn, off that callus. If you do have a corn is like a plugged sweat gland. It's like a spike that presses into the area. With a lot of rubbing, it feels like almost a small pebble develops on there. I see this a lot where people think it's a bone problem, but it's really a skin problem. You can have your podiatrist shave that out, or you can soften it up with foot soaks, gels, creams. I list all my favorites below, including the gel pads. That can make a big difference. Corrector devices. So there's splints, there's pads designed to help. These pads can help realign the toe. Do they work really well? Well, I think the better option is the next one we're going to talk about. And the next one is insoles and orthotics. Insoles and orthotics are perhaps the #1 solution for this problem. By holding your foot straight, it prevents that fifth toe from rubbing against the outside of your shoe. And let me show you that exact demonstration. So when I push down on the foot, see how it turns out? That outside rubs against the side of the shoe right here. So I'm going to show you that again. When it pushes, your foot flattens out. That's called overpronation. And your fifth toe right here rubs against the side of your shoe. Now on the other hand, if I take my orthotic and I push on it, see how it's now no longer flattening out? Because the arch maintains. As it presses, the foot does not externally rotate. But for example, if I get rid of the orthotic, see how it now turns out? So the middle of the foot is called your Lisfranc joint right here. And if the foot cannot be held through the heel, it flattens out this way, and that fifth toe rubs against the side of the shoe. There's two types of orthotics. You can get pre-made ones, and I list my favorites down below. But now there's great systems too. You could have your podiatrist build an orthotic, which I love to do in person. That does extremely well, and the patient can get great results. But now technology has improved so much that you can essentially use your phone. You could consult with a specialist over your phone, talk about the knuckle right here. It stops and it takes pressure off that fifth toe joint. You can make a special groove in your custom orthotic. You can make it more built up. There's a lot of special modifications you can make, and the prices on these things are coming down. I list my favorite ways to get your custom orthotic built down below. That makes a huge difference. I highly recommend checking that out before you consider significant types of surgeries or more advanced treatments. This works the vast majority of the time for people. And the beauty is these custom orthotics can now be made for more fancy shoes. You can even basically check out the ID code on the shoe that you like to wear, and the orthotic is fitted in the front to take pressure off that. A lot of improvements being made for your Tailor's bunion pain. The shoes you want are stability shoes. I love ortho feet. I love lots of great running shoes. What you also want is good home slippers. So if you're barefoot at home, that can press into the ground. That toe will get sore. It will get rubbing on the floor. Slippers, sandals, these can be built with an insole inside of them. This can make a big difference and take pressure off that fifth toe significantly. Look for shoes with a lot of cushion, a lot of arch support, but hey, we've done all the work. We've taken the pressure off there. Check that out below. We link our favorites. And muscle strengthening. For the sake of this video, it's already longer than I want. Foot exercises, stretches, calf stretches, foot motions. This can make a big difference. I have free videos down below. I even have my 30-day guide for more advanced conditions. For example, if you have weak muscles in your thighs, glutes, hamstrings, we go over certain exercises like calf stretches, foot stretches, toe curls, ankle exercises, and toe specific exercises down there. But here's the real secret to Tailor's bunion pain. The reason your foot flattens out, as I showed, and rubs against the side of your shoe. So it can flatten into the ground into the side of your shoe. It's more outside of the foot pain, not just Tailor's bunion pain. When I take x-rays of people, it's not really the bone that's deformed. It's not really the knuckle. It's that people get tight through their lower back, their hamstrings, their glutes, their calf muscles, and their feet turn out. You put pressure on that knuckle. It causes you a lot of pain, a lot of tenderness, and that's the big problem. You want to get a biomechanical assessment. So check out your lower back, your hips, your knees, your hamstrings. With us at the office, we can work with you on physical therapy. There's massage guns, massage rollers, there's massage devices for your feet. There's compression calf devices that massage you while you're sitting at the computer desk. There's leg compression. There's physical therapy. I go over all those below in my stretching exercises. Get your body straight so that your feet are not turning out and the side of your fifth toe is not rubbing. Proper shoes, proper insoles, the occasional gel pad for weddings and special events. That's really all you need. But if that still doesn't work, I go over the surgeries for the fifth toe bunionette. The surgeries can make a big difference. There's a lot of different types of surgeries. Check out my guide below on the bunionette recovery time and best recommended surgeries for your fifth toe. And then if that's not working, you want to come in to see a podiatrist like myself. And if you're in Michigan, I would love to see you. I usually follow with pre-made orthotics that I have available for free in my office in most cases to start off with. And then we have a 3D printer that can print custom orthotics a lot of the times for very cost-effective rates, much cheaper than the pre-ordered ones even online. What I do is I do a biomechanical exam. I check your hips, your knees, your thighs, your hamstrings, your calf muscles. I bend your ankles up and down, your big toe joints up and down. I see where it's tight. What kind of adjustments do we have to make? And the thing is, you can adjust them from appointment to appointment. You want to look at your leg kind of like a dentist looks at a tooth. You don't want to straighten that tooth all at once. You want to take that tooth and get used to it a little bit straighter, a little bit straighter, a little bit straighter. And when your foot is now straight, that soft tissue gets used to it. Your hamstrings, your thigh muscles, your hips, your lower back, over a couple months get used to walking straight. That's when walking barefoot makes sense. That's when strengthening your muscles makes sense. At first, you want to just get used to walking straight and your muscles will adapt. Using this method, virtually 100% of patients that come see me do see improvement. And there's no real risk. The cost does not have to be high. What's a $20 or $30 or $50 pre-made orthotic when you're weighing surgery as a result? And here's the real big secret. All of this stuff is around for a reason because it works. There's happy people and there's unhappy people with all of these. You just have to use it correctly. And the big secret with orthotics are nobody really makes a lot of money on these anymore. Compared to like a $20,000, $30,000 surgery for a hospital, why would the hospital advertise a pre-made orthotic? Why would the medical system advertise a $20 orthotic when they can make money on a $30,000 surgery and a patient for life? It's something you have to think about. And that's why there's not that many studies for orthotics anymore. The reality is, in my opinion, orthotics work amazing. This stuff all works. The barefoot walking works, the orthotics, the good shoes, they all work, but they have to be used at the right time and the right sequence. I go over my favorite shoes, my favorite orthotics, and my condition-specific guides. If you're in Michigan, come see me. But the big secret as well is you have to get a biomechanical exam. If something's hurting when you wear your orthotics, you have to get it looked at. Is it a bad knee, a bad hip, a bad foot? You might have to massage. You might have to use a foam roller. You might have to get physical therapy. You might have to get an injection. You might have to get shockwave therapy. Ungunk your body. Start walking straight. And if you want to walk straighter, check out my 30-day guide to transform your health. You won't regret it.